In health news tonight, the shortage of primary care doctors in our state.
There are still not enough of them to meet patients' needs. News 8 medical reporter Jocelyn Maminta has been following this trend. Jocelyn.
Sonia Darren, while more medical students are considering the family practice route, the lucrative specialties are still indeed more popular, but changes in healthcare could change the landscape.
It's the last year of residency in internal medicine for Dr. Ranjan Misra at UConn School of Medicine.
I'm actually applying for jobs right now.
And she's seeing a positive change for primary care doctors.
I've noticed just applying for jobs that the compensation is greater in rural areas because there is a shortage of physicians there. And some of them actually have federal loan repayment programs, which is a big plus for us because we come into the work field with an insane amount of loans.
The high cost of education, lower reimbursements make the primary care route a tough sell to medical students. But the Affordable Care Act could change that.
Frankly, the different policies coming out from the government all focusing on primary care and accenting the positives of primary care. They're more drawn to it.
Dr. Bruce Gould is the Associate Dean for Primary Care at the medical school.
You still have to, at the admissions level, look for students that are committed and have a calling to heal people, to care. And, you know, not that all students don't come in that way. I think the system itself, to a degree, pushes them away. And here at UConn, we're certainly trying to change that lay of the land, change the culture.
Celebrating National Primary Care Week is part of the overall blueprint. Second-year student Devora Donnell wants to go into family medicine.
People usually think of primary care physicians as knowing less. However, it's the exact opposite. Because as a primary care doctor, you have to know about every part of the body, every age.
Adding that in primary care, it's where she will have the most potential to make an impact.
You're looking at the person as a whole. So you get to help with prevention and help keep the patient healthy so that way they don't end up in the emergency room or don't end up relying on a specialist.
Let me just listen to your heart and lungs.
Patients will only benefit with doctors like Devora Donnell and Ranjan Misra.
To encourage more students, UConn has a mentoring program allowing them to work with a primary care doctor in private practice once a week.